I like to listen. I was always taught that the patient's going to tell you what's wrong. They're basically going to get to the bottom of what's wrong. So just listening, and obviously we have questions we ask, but listening and letting the patient talk is very important. What sets me apart from other physicians, I believe, is that I take into account the entire picture. Just because there is an indication for a procedure and a patient has a problem doesn't mean that you have to do a procedure on that patient. You have to take that whole picture into account and realize that every procedure has its positives and its negatives for every patient, and every patient is an individual, and that has to be applied in all cases. What I would change about patient care is probably the way that patients treat themselves. Preventative care is very important. Not doing things that are bad for you, smoking, bad diet, people that don't exercise very much. All those things are very important for the overall health, especially vascular health. What brought me to Genesis was it's very impressive. I think it's a diamond in the rough. I think people, if they got to know Genesis and saw Genesis, would be amazed at all of the specialties that are here, all the things that are done here. It's not your typical small town hospital. It's a major center that offers pretty much everything that any other facility offers. What's impacted me the most as a physician is just walking out of the operating room, walking into the waiting room, and seeing the patient's family and seeing the patient in the recovery room after you've made a difference. Be that a cold leg that may have showed up in the emergency department that you clean out and get the clot out, or that you maybe do a bypass on. Just seeing the look on the family and the patient's face is a wonderful feeling.